My name is Chris Feyjoo-Sanchez. I'm a Master's of Social Work student at Hawaii Pacific University, and today I'm going to be presenting my findings for my capstone project, which focuses on beliefs about mental health stigmas from Hawaii-based United States Air Force service members. So before we get started, I'm going to go over our agenda for today. So first, I'm going to do a quick introduction to the topic I'm looking at. Next, I'm going to go over my motivation for looking at this topic. I'm going to give a quick rundown of the methodology I used to conduct my research. We'll go over some of the results from my findings and then give a quick summary. So a quick introduction. The United States Air Force faces a problem with negative stigma surrounding seeking mental health help among its members. Despite the availability of resources, a significant portion of enlisted force believe that seeking mental health care will negatively impact their career. Portions of this issue are rooted in an Air Force culture where the value of service before self can discourage individuals from seeking mental health care. So in carrying out my study, I focused a study on surveying Air Force members in Hawaii and assessing their willingness to seek mental health support. This limited scope study provided valuable insights into the beliefs of Air Force service members in Hawaii with regard to mental health awareness. My personal motivation for this study is that I am actually an active duty member of the United States Air Force right now. And with this Master of Social Work, I plan to start getting experience hours to eventually sit for my licensed clinical social work exam and then commission as a licensed clinical social worker within the Air Force, helping combat mental health stigmas within our force and encourage others to get the help they need. So in conducting our survey, we had a very simple requirement for our participation requirement, and that is that all members participating had to be either United States Air Force active duty members, United States Air Force National Guard members, or United States Air Force Reserve members, all of which would have to be stationed in Hawaii at the time of the stay. Survey participants were given 25 Likert scale questions in which they were asked to provide a level of agreement with various mental health stigma-related statements. Survey statements included the following. These are not all encompassing. The first example would be people with mental health problems cannot be counted on. Most people with mental health problems are just taking their symptoms. And lastly, seeking mental health help will make me feel more empowered at work. I wanted to focus and make sure that the statements that provided, the 25 statements that provided were not all negative statements, so as not to have the participants feel that there is a specific type of hypothesis already set for the stigma we were looking at, and so that they would give their honest feedback either way. So I have 4 of the statements that I provided in the survey here for this presentation, just to give an idea of what type of responses we looked at. The 4 results I'm providing here are the ones that I thought were most important with regard to our research question. The first statement here is there doesn't seem to be any stigma associated with seeking mental health care in the Air Force anymore. As you can see, we had a 82% disagreement or strongly disagreeing viewpoint from our participants, which goes to show that a large portion of the current Air Force service members in Hawaii would agree that there is still stigma associated with seeking mental health in the Air Force. The second statement that we were looking at is therapy/counseling does not help for mental health problems. As you can see, over 90% of individuals that participated in the survey either disagreed or strongly disagreed with that statement. These are some statistics because it shows that even though people do get associated with getting mental health help, they do agree that therapy and counseling is good. So if we can combat the underlying stigma, then there's a good chance that we can get a large number of people who need mental health help to go get counseling or therapy. The next statement is seeing a mental health provider would make me feel weak. And as you can see, we have over 50% of individuals that disagree or strongly disagree with that statement. While that's good, we can also see that about 11% of individuals agreed that seeing a mental health provider would make them feel weak. So hopefully providing this information to mental health providers in the military and in the civilian world that are seeing military clients, veteran clients, that this knowledge can help them somehow combat that perspective that seeking help is a sign of weakness. The last statement that I wanted to provide was my career options would be limited if I was going to therapy or counseling. We see here that just over 50% of people disagree with that statement, either strongly or just generally. However, around 18% of individuals agreed that seeking mental health help would limit their career options. Unfortunately, we did not have any further questions on this statement. But if we were to do another study on this topic, I would want to take a deep dive into why individuals felt that their careers would take a hit or their options would take a hit if they were to seek mental health help, just in order to combat that stigma and get more people that need the help into counseling or therapy, no matter what. So here are some of the major findings from our survey. Of the 25 survey questions analyzed throughout the survey, 15 questions garnered at least one response that would indicate the presence of mental health stigma amongst Air Force service members in Hawaii. While that is the case, survey responses also show that mental health stigma in the Air Force are being addressed and mindsets on the matter are shifting. Findings from this study survey indicate that there is potentially a shift in cultural messaging within the Air Force about mental health intervention, which is awesome. So in conclusion, information derived from this survey may provide social workers in Hawaii with information about the attitudes and beliefs of service members they serve regarding mental health. And information gained from this study could also help Hawaii-based civilian licensed clinical social workers to better address the concerns of their military and veteran clients.